10 warning signs of mental illness. Recognize and take action. Mental illness refers to a wide range of conditions that affect a person's thinking, emotions, behavior, and overall mental well-being. These disorders can cause significant distress and disrupt a person's ability to function in daily life. Mental illnesses include conditions such as depression, anxiety, schizophrenia, and bipolar disorder, among others. They can result from a combination of genetic, biological, environmental, and psychological factors. Early diagnosis, treatment, and support are essential for managing mental health conditions and improving quality of life. Mental illness is common and can affect anyone, regardless of age, gender, or background. Watch out for these 10 signs. Persistent sadness or depression, ongoing feelings of hopelessness or a lack of joy in daily activities. Extreme mood swings, sudden and extreme changes in emotional states, such as feeling very happy one moment and very angry or sad the next. Excessive anxiety or worry, constant fear or worry that is out of proportion to the situation. Difficulty concentrating, trouble focusing or thinking clearly, which can affect work, school, or daily tasks. Social withdrawal, avoiding social interactions and activities that were previously enjoyed. Changes in appetite or weight, significant weight loss or gain, often due to changes in eating habits or lack of interest in food. Sleep disturbances, difficulty falling asleep, staying asleep, or sleeping too much. Irritability, a heightened sense of frustration or anger, even over small issues. Hallucinations or delusions, experiencing things that aren't real, such as hearing voices or having false beliefs. Fatigue or lack of energy, a feeling of constant tiredness or lack of motivation even after rest. These symptoms can vary in intensity and duration depending on the individual and the specific mental health condition. If you or someone you know is experiencing multiple symptoms, it's important to seek professional help for assessment and support. What are the extremes of mental illness? The extremes of mental illness can refer to the most severe manifestations of psychiatric disorders, where the symptoms significantly disrupt a person's ability to function in daily life. These extreme conditions can vary depending on the specific disorder, but often include intense distress, inability to differentiate reality, or complete withdrawal from society. Some of the extreme forms of mental illness include schizophrenia. This disorder can lead to extreme hallucinations, hearing voices, seeing things that aren't there, and delusions, false beliefs like believing someone is controlling their thoughts. People with schizophrenia may lose touch with reality, making it very difficult for them to maintain relationships, work, or care for themselves. Severe bipolar disorder. In extreme episodes of bipolar disorder, individuals can experience manic states with reckless behavior, severe impulsivity and irritability, or depressive episodes where they feel paralyzed by sadness or hopelessness. The swings between these moods can become so intense that they interfere with a person's ability to function in everyday life. Severe major depressive disorder. In its extreme form, major depression can cause a person to lose all interest in life, often accompanied by suicidal thoughts or attempts. Extreme cases may involve complete apathy or an inability to perform basic daily activities like eating, bathing, or getting out of bed. Obsessive-compulsive disorder. When OCD is at an extreme level, individuals may engage in obsessive rituals that take up hours of their day. For example, compulsively washing hands or checking things repeatedly, which can severely disrupt their ability to engage in daily life or maintain relationships. Post-traumatic stress disorder, PTSD. Extreme PTSD can lead to frequent flashbacks, hypervigilance, nightmares, and avoidance behaviors that prevent someone from participating in normal activities. In some cases, people might develop severe emotional numbness or dissociation from their surroundings. Anorexia nervosa, severe eating disorders. When anorexia is severe, individuals may engage in extreme food restriction, dangerous weight loss, and a distorted view of their body image. In extreme cases, anorexia can result in life-threatening health issues, including organ failure and death. Borderline personality disorder, BPD. In its extreme forms, BPD can lead to intense emotional instability, difficulty maintaining relationships, extreme mood swings, and self-destructive behaviors like self-harm or threats of suicide. People with BPD may also experience a distorted sense of self. Psychotic disorders. Severe psychotic episodes can lead to complete disconnection from reality, characterized by delusions, false beliefs, or hallucinations, perceptions of things that aren't there, which can lead to violent behavior, isolation, or a complete inability to function in society. Dissociative identity disorder. In extreme cases, DID, formerly known as multiple personality disorder, involves a person developing distinct identities or personalities that may take control of their behavior. This can result in a significant loss of memory and a fragmented sense of self. This is a state of abnormal motor behavior where a person may become immobile, unresponsive, or exhibit rigid postures. It can be a severe manifestation of a mental illness, such as schizophrenia or mood disorders, and may require medical intervention to address. These extreme forms of mental illness typically require intensive treatment, which may include a combination of hospitalization, therapy, and medication. Early intervention is critical to managing and improving outcomes.